Strode and welcome to Straightforward. Today, my first guest is Dr. Chauhan from Renal Associates, LLC. Welcome.
Well, thank you.
Well, you are a specialist, and a lot of people don't really know what a nephrologist is. So I'd like for you to explain to our audience exactly what your specialty is.
Our specialty deals with kidney disease as well as hypertension and some electrolyte like sodium, potassium, and other problems, especially also for the kidney transplant as well.
Kidney transplant? Oh, now see, that's my first time hearing that part. Usually when we think of the kidney doctor is what people normally call you all. We're thinking of dialysis, but it's a broader service that you're providing on an ongoing basis. Okay, can you explain a little what happens that brings a person to being on dialysis?
We all know, everybody associate nephrology or kidney specialist being a dialysis doctor.
Right.
But it's far and above and beyond dialysis because our job is to prevent the progression of kidney disease.
Okay.
How we can prevent not to go on dialysis, or if they're on dialysis, how to provide the different modalities of dialysis, as well as to take care of their hypertension and also the renal transplant. And the chronic kidney disease is the major thing which we are trying to emphasize in the community to find early diseases in these patients and work on them early on rather than waiting until they reach the dialysis.
Okay, so when we get to the dialysis, we're like at the end.
At the end.
And what we want to do is the preventative on the front end. And our main thing I know is that oftentimes people suffer from hypertension, and that has a major impact on your kidneys.
That's correct.
All right. And so what are you doing to help us in terms of understanding what we should be doing to avoid that end result?
What we are really working along with the primary care physician and the local community to make aware about hypertension. And so we can catch on this disease early on and made them aware that what are the complication and implication of uncontrolled hypertension is. And that's what we are encouraging them to intervene early on so we can prevent the progression of kidney disease associated with hypertension.
Right. So you said uncontrolled. So are we saying those individuals that are not on medication or those individuals that are on medication but still have very poor dietary habits?
I think it goes both ways. There are a large number of patient population who didn't recognize they have hypertension because they've never been to a doctor.
Really?
There are population, and that population also need to be intervened early on. And then other patient group of population, those who are on antihypertensive medication or blood pressure medicine, but they're not taking it properly, or they're not following the dietary restrictions, which we are trying to encourage them. And I think so the education can make them understand a little bit better, and we want to reinforce, and we really want to empower them by education to these patients, how to prevent this progression. Not only kidney disease, but also other complication, cardiovascular complication, heart disease, and stroke, because hypertension is the major cause of all of the problems.
Oh, okay. So if we have the uncontrolled hypertension, it's bigger than just the kidneys.
That's correct.
We're looking at the heart, it's putting a strain, and so it's kind of like a car. It's just going to tear the whole thing up.
That's true.
Okay. So we live in the Bible Belt, and we are in the South. So I know you've been here long enough. We like everything fried, deep fried. We like all of the food highly seasoned, but we should not be doing that if we are hypertensive.
That's true. And that's what we're trying to emphasize, and how to modify your diet, how to just prevent from frying to baked, how to decrease your seasonings and try to prevent the canned food as much as possible. And that helps if we keep on reinforcing them over and over again, and educational programs.
Right. So the canned foods we know is the least expensive, but a lot of times when people are limited with their income, they will go to what's the least expensive, but it's not necessarily the most nutritious. It's not the best. So if someone is using, or their income kind of predicts they have to use the canned foods, what should they be doing?
One thing, there are options of no salt canned foods.
Okay.
So they can work on that option. And second thing, we try to tell them to drain and clean that whatever the canned foods are.
So they should be
prevent
pouring off the
pouring
liquid.
off the material, liquid around it, and then wash it off if possible.
Okay. So the dietary classes, is that something that you all do have that available in your facilities? And it's free.
That's
so
correct.
that comes with the care that you're providing to your patients on an ongoing basis.
That's correct.
And you have in the dialysis centers, you actually have dietitians or people that can help coach folks on what they should and should not be eating.
Yeah, I think that we have a variety of resources in our own setting, especially educational materials are there and dietitians are available, and the educators are there who can inform them what is the easiest diet for that particular patient.
Okay, so it's not a universal diet.
Not the universal diet.
It's kind of like customized based on
according-
the individual and what their markers are.
Yeah,
so to
what are the
speak.
needs are.
Oh, okay.
That's correct.